Welcome to the Plastic Surgery Playbook.
Glad to be here.
So breast augmentation has actually just been dethroned.
Yeah, completely knocked out of the top spot.
Right. The new king of cosmetic surgery is actually a procedure invented like 50 years ago. And, well, it once cost a woman her leg.
Which is just wild to think about given how common it is today.
Exactly. Today we're looking at the bizarre post-pandemic explosion of liposuction. And if you're sitting there thinking this is just a vanity thing for the young and famous, the data is going to totally flip your perspective.
Oh, absolutely. The numbers tell a completely different story.
We are pulling from comprehensive industry data today, specifically the American Society of Plastic Surgeons statistical reports. And we've also gathered insights from top experts in the field like Dr. Randy Rutterman out of Atlanta, Georgia, and Dr. Darrell Hoffman.
Yeah, both incredible sources for this.
But our primary guide for this audio is Dr. Shim Ching, who is a highly respected, board-certified plastic surgeon practicing in Honolulu, Hawaii.
His content is fantastic.
It really is. He's put out some incredibly candid material detailing exactly how the industry has changed, what the new technologies, actually do to your fat cells, and what patients are really experiencing behind closed doors.
There's a lot of misconception out there that he clears up.
Totally. So let's just start with the most glaring mystery here. Why is a 50-year-old procedure suddenly the biggest trend in the world right now?
Well, to figure out the why, we really have to look at the who, because in the immediate wake of the pandemic, liposuction saw this massive, 23% surge.
Wow, 23%.
Yeah, in 2023 alone, there were 347,782 procedures performed.
That's almost 1,000 surgeries every single day.
Basically, yeah. The scale is staggering. And the demographics, they tell a really surprising story. It's not the Gen Z TikTok crowd driving this. No, it's actually Gen X. So patients aged 40 to 54, along with elder millennials, they account for 45% of all liposuction procedures right now.
Oh, wow. Almost half the market is people in their 40s and 50s, so it isn't just 20-somethings looking for a quick fix.
Not at all. And we are also seeing this rapid shift in gender dynamics. Historically, cosmetic surgery has been overwhelmingly female, right?
Right, of course.
But men now make up about 6 to 7% of the overall aesthetic patient base. And when you look specifically at chest and core body procedures for men, that number recently jumped by 10%.
Okay, so what are men asking for compared to women?
Well, they're generally walking into clinics with very different architectural goals, mostly based on genetics. So men are targeting the abdomen and flanks to achieve a specific V-shaped torso.
Ah, okay.
And there's been a massive rise in gynecomastia surgery, which is male breast reduction, whereas women are often utilizing the procedure to sculpt a slimmer, curvier waistline, really prioritizing that hourglass silhouette.
That makes sense. But knowing who is getting it done still leaves the timing up in the air. Why this sudden explosion right now?
It really comes down to a perfect storm of, 3 cultural phenomena colliding.
Okay, what's the first one?
First is the remote work Zoom boom. People spent 2 years staring at themselves on high-definition video calls.
Oh, yeah. The terrible lighting, the weird angles.
Exactly. People became intensely aware of their jawlines, their double chins, and just how their face sits on their neck.
Totally.
Second is the very real phenomenon of COVID weight. The pounds people put on during lockdowns that just stubbornly refuse to budge, even after the gyms reopen.
Right, the sourdough starter weight?
Yeah, exactly. But the third, and arguably the most disruptive factor, is the explosion of semaglutide weight loss drugs.
The Ozempic era.
Yes, exactly.
Okay, let me try to visualize how a weight loss drug actually drives people to get fat removal surgery. Because on paper, that sounds so counterintuitive.
It does, but it makes biological sense.
It's like, okay, think of a swimming pool. If a pool is filled right up to the brim, the surface of the water looks perfectly flat and smooth, right?
Right.
But these weight loss drugs are acting like a massive open drain. They drop the water level in the pool incredibly fast. And suddenly, all the uneven contours, the slopes, and the varying depths at the bottom of the pool are totally exposed.
That's a brilliant way to look at it.
So you lose the overall volume, but the underlying distribution of your fat cells is still, genetically uneven.
And that pool visual captures the biology perfectly, because semaglutide is a systemic weight loss tool. It shrinks fat cells all over your body simultaneously.
They can't spot reduce.
Exactly. It cannot spot reduce. A patient might drop 40 pounds relatively quickly, but they still have this disproportionate, genetically predetermined collection of fat cells on, say, their lower abdomen or their flanks.
Right.
So liposuction steps in as the finishing tool to contour those specific stubborn areas that the medication just exposed.
Which naturally leads any listener to the most critical question, will this actually work for my specific body?
And that's the big one.
Yeah, and this is where Dr. Shim Ching's insights from Honolulu are just invaluable. But before he even gets into his modern techniques, he tells this historical anecdote that honestly blew my mind.
Oh, the 1921 story.
Yes, he talks about how far the safety of this procedure has actually come, dating back to 1921 France.
Yeah, it's a stark reminder of the risks of primitive medicine. Dr. Ching recounts the very first recorded attempt at something resembling body contouring.
Right, it was a ballerina, right?
Yes, a ballerina wanted to thin out her ankles and calves, so a surgeon attempted to cure it, which literally means to scrape the fat out using rudimentary tools.
That sounds awful.
It was. The surgical technique was so violently abrasive that he severely damaged the local blood vessels. The tissue completely lost its blood supply, necrotic tissue set in, and she tragically ended up losing her leg to gangrene.
That is just horrifying. It really underscores why you don't just let anyone start poking around under your skin. And it brings us directly to Dr. Ching's 3 things no one tells you about modern liposuction from his videos. Let's unpack the first one, which is all about figuring out if you are actually a good candidate.
Right, so Dr. Ching relies on what he calls the pinch test. Surgeons can only safely remove subcutaneous fat.
Which is what exactly?
That is the soft, squishy fat that lives just beneath your skin. Literally the fat you can physically pinch between your fingers.
Okay.
Liposuction cannot touch visceral fat. Visceral fat is located deep inside the abdominal cavity. It sits underneath the hard muscle wall surrounding your internal organs like your liver and intestines.
So it's like structural fat.
Yeah, if someone's abdomen is firm and protruding because of a buildup of visceral fat, running a suction tube under their skin will not flatten their stomach at all.
Wait, so if you lose 50 pounds past the pinch test but you have loose skin, lipo isn't the magic fix. It actually makes it worse.
It absolutely makes it worse.
No.
Yeah, because liposuction only removes volume. It does not tighten significant amounts of loose skin. Think of a stretched out balloon.
Oh, I see where this is going.
Right. If you already have poor skin elasticity, say after a massive weight loss or post-pregnancy, and a surgeon goes in and hollows out the remaining fat underneath that skin, you are removing the scaffolding.
So the skin just sags.
Exactly. The skin will simply drape and hang even more loosely. In those specific cases, the patient requires an excisional surgery, like a tummy tuck or a body lift, to physically cut away the excess skin.
Wow. So if you're sitting there thinking you can just use lipo as a shortcut to drop 20 pounds and look perfectly toned, Dr. Ching's data is going to be a harsh reality check for you.
Very harsh.
But let's assume you pass the pinch test and your skin elasticity is great. Dr. Ching's second secret is all about the scars. He has this philosophy of scarless procedures. But I mean, how is surgery ever scarless?
Well, they are scarless in the sense that they are virtually undetectable to the naked eye. Dr. Ching points out that the entire objective of body contouring is to look great with minimal clothing on, like a swimsuit.
Right, you don't want a huge zipper scar across your stomach.
Exactly. It totally defeats the purpose.
Yeah.
So he utilizes incisions that are incredibly tiny. We're talking just 2 millimeters long.
2 millimeters. That is basically the size of a pen tip. How do you even get tools through that?
The modern tools are literally designed to be that microscopic. But more importantly, the secret lies in where he places those tiny incisions.
Oh, like hiding them.
Yeah, he acts almost like a tailor hiding the seams of a garment. He places them in the natural anatomical creases of the body.
Okay, where specifically?
He might hide an incision deep in the pubic area where a bikini bottom would naturally cover it, or tucked high into the fold of the armpit, or even completely hidden inside the belly button itself.
Oh, that's clever.
Right. Once the patient fully heals, there is virtually no visual evidence that a surgical instrument ever entered the body.
The attention to detail there is just wild, and it plays right into his third secret. How does a surgeon know exactly how much fat to take out? Because human bodies aren't perfectly symmetrical to begin with.
No, we are naturally very asymmetrical, and this is where the engineering and artistry of the procedure really overlap.
Okay.
Dr. Ching highlights a fundamental mechanical challenge. The patient is lying down flat during the surgery.
Right.
When you lie down, gravity immediately shifts your tissue. Your body looks completely different than it does when you are standing up in front of a mirror.
Yeah, everything just kind of flattens out and moves to the sides.
Exactly. So a surgeon cannot simply rely on visual cues while the patient is sedated on the operating table. Otherwise, they would create a very lopsided result once the patient stood back up.
So if a surgeon is basically flying blind regarding the final shape while the patient is lying down, how do they know what they are actually looking at?
Topographical mapping and strict mathematical metrics.
Meaning what? Drawing on the body?
Yes. Before the patient is ever sedated, while they are standing upright, the surgeon draws meticulous maps on their body with a marker, outlining the exact zones of excess fat and natural asymmetry.
Okay, I've seen pictures of that. It looks like a contour map of a mountain.
That's exactly what it is. During the surgery, Dr. Ching is constantly using his hands to physically pinch and roll the skin, assessing the thickness of the fat layer in real time.
Wow, so it's very tactile.
Very. And he also precisely measures the exact volume of fluid going into the body and the exact ratio of fat and fluid being extracted into the canisters.
Ah, so it's a numbers game too.
Exactly. If his pre-op map notes that a patient's left flank is naturally larger than the right, he uses those exact milliliter measurements to extract slightly more from the left side to engineer perfect symmetry.
It's incredible how much math and special awareness goes into something we casually call fat removal.
It really is an art form.
So now that we understand the strategic approach, we really need to look at the actual tools of the trade. Because the menu of liposuction options out there is overwhelming. Oh, there are so many options now.
Yeah. Dr. Randy Rutterman of Atlanta, Georgia, and Dr. Darrell Hoffman both break down these different technologies beautifully. So let's start with the baseline. Tumescent or traditional liposuction?
Yeah, tumescent liposuction is the foundation of the modern era. Introduced in 1985 by Dr. Jeffrey Klein, it completely revolutionized the safety profile of the surgery.
How so?
Well, before a cannula, which is the thin, hollow steel tube used to suction the fat, is even introduced, the surgeon injects a massive volume of tumescent fluid into the target area.
Okay.
This fluid is a carefully calibrated mixture of saline, lidocaine, and epinephrine.
Okay, I get the saline for volume and the lidocaine to completely numb the tissue so the patient doesn't feel pain. But why inject epinephrine? Doesn't that affect your heart rate? Why put that under the skin?
It's a fair question, but in this specific localized application, epinephrine acts as a powerful vasoconstrictor.
Meaning it shrinks things. Yes. It literally shrinks the microscopic blood vessels, the capillaries in the fat layer. By constricting those vessels, bleeding is reduced to an absolute minimum during the extraction.
Oh, wow.
Yeah, this makes the fat easier to separate and drastically reduces post-surgical bruising and trauma. It is so effective at protecting the patient's blood supply that it remains the gold standard today, holding over 41% of the total market share.
That makes perfect sense. So you numb it, shrink the blood vessels, and suction it out. But then we start introducing energy into the mix. Let's talk about laser-assisted liposuction, specifically smart lipo. And Dr. Ching was actually the first surgeon to offer this in Hawaii, right?
He was, yeah. Laser-assisted liposuction takes that tumescent foundation and adds a thermal element.
Heat.
Exactly. A microscopic laser fiber is actually threaded through the cannula. Before the suction is turned on, the laser energy is fired directly into the fat tissue.
What does it do?
It physically melts the fat cells, turning them from a solid state into an oily liquid.
Oh.
Yeah, and liquid is incredibly easy to gently suction away with minimal force. But the secondary benefit is what makes it so popular. The heat from the laser essentially creates controlled thermal trauma to the underside of the skin.
That sounds bad, but I assume it's good.
It's very good. The body responds to that heat by stimulating its natural collagen production, which actually helps tighten and shrink the skin from the inside out.
And there's hard data backing up how much more efficient this is. The sources included a clinical study on patients with lipedema, which is a painful chronic fat disorder.
Right. The lipedema study provides excellent comparative data on the physical toll of the surgery. They looked at traditional versus laser-assisted liposuction.
And what did they find?
The laser group saw their average operative time drop significantly, from 122 minutes down to just 94 minutes.
That's a huge time savings.
It is. Blood loss was also reduced from 551 milliliters down to 408 milliliters. And crucially, the patients reported significantly less postoperative pain because the tissue wasn't subjected to the same aggressive manual scraping.
Okay, so traditional lipo is almost like manually shoveling heavy snow off your driveway, but laser and ultrasound lipo are like melting the snow first, so it just flows away down the drain.
Exactly. And because you're melting it, you aren't scraping the pavement underneath. That means significantly less trauma to the surrounding blood vessels and nerves.
You mentioned ultrasound just now. That brings us to Vaser technology.
Right. So instead of thermal heat, Phaser uses ultrasonic sound waves.
Sound waves.
Yeah, the probe emits high-frequency sound waves that create microscopic bubbles in the tumescent fluid. These bubbles rapidly expand and collapse, a process called cavitation.
Okay.
The force of those collapsing bubbles gently vibrates and tears apart the fat cells while leaving the denser tissues, like nerves and blood vessels, completely intact.
Where does a surgeon usually deploy sound waves instead of lasers?
Phaser is particularly ideal for areas of the body where the fat is incredibly dense and fibrous.
Like where?
The male chest for gynecomastia surgery or the upper back are prime examples. Those areas are notoriously difficult to treat with manual force alone. But the ultrasonic cavitation emulsifies that tough, fibrous fat beautifully.
Makes sense. We also have power-assisted liposuction on this menu. Does that just mean the machine is stronger?
Not necessarily stronger suction, but mechanized movement. Power-assisted means the cannula itself has a built-in motor that creates a rapid, vibrating oscillation.
Oh, so it moves on its own.
Exactly. It moves back and forth at a high speed on its own. This drastically reduces the physical fatigue on the surgeon's arms and shoulders, allowing them to work with much more precision and consistent efficiency over a long, multi-hour procedure.
Which brings us to the absolute pinnacle of this technology, HD Lipo 360 with ab etching. This isn't just removing fat. I mean, this sounds like creating human anatomy from scratch.
It really is the ultimate evolution of the craft. Traditional liposuction aims for a uniform, flat reduction of the fat layer. High-definition Lipo 360 treats the torso three-dimensionally, contouring the front, the flanks, and the back all at once. But the ab etching component is where it becomes highly specialized.
How so?
The surgeon doesn't just flatten the stomach into a board. They strategically leave very thin, deliberate layers of fat right over the patient's natural musculature, and they carve deeper channels into the intersections where the muscles meet.
Wow. So they are essentially tracing the abdominal wall to manufacture the appearance of a chiseled six-pack for men or a really toned athletic definition for women.
Yes, they are revealing and amplifying the underlying muscular architecture that is already there, using the remaining fat to create shadows and highlights.
That sounds incredibly difficult.
It requires an immense amount of anatomical knowledge and artistic vision from the surgeon to make it look natural as the body moves.
Okay, so a patient hears all this. They hear about lasers, melting fat, ultrasound bubbles gently vibrating it away, and surgeons carving out six-packs. It sounds like sci-fi magic.
It really does.
The natural assumption is that you wake up from the anesthesia, throw on a swimsuit, and go straight to the beach looking flawless. But the reality of the recovery process is quite different, isn't it?
Oh, completely. Managing patient expectations post-surgery is perhaps the most difficult part of a plastic surgeon's job. First, we have to bust the biggest, most persistent myth. Liposuction is absolutely not a weight loss procedure.
Which brings up the craziest psychological irony for the patient. You go into a clinic specifically to lose stubborn fat, but you step on the scale the very next day, and you actually weigh more than you did before the surgery.
Yes, almost always.
Why does that happen?
It all comes down to the biology of trauma and fluid dynamics. We just talked about the tumescent fluid surgeons are pumping liters of heavy saline directly into your tissue.
Right.
Combine that with the body's natural inflammatory response to surgery. When you remove a pocket of fat, you are leaving behind a physical void, an empty space between the skin and the muscle. The body perceives that void as an injury, and the lymphatic system rushes fluid to the area to protect it and heal it. The fat is gone, but a massive volume of fluid has temporarily replaced it.
Oh, so it's just water weight, basically.
Yes. Patients need to understand that the scale is absolutely not the metric of success during recovery.
How long does it actually take to heal? Because the downtime must vary wildly depending on which menu option you chose.
It varies significantly based on the trauma. With traditional tumescent liposuction, because there's more manual force required, patients typically need to take 7 to 10 days off from work. And the deep tissue healing takes 1 to 3 months.
That's a decent chunk of time.
It is. However, with laser or smart lipo, because the fat was melted and gently removed, the downtime is drastically reduced. Patients often only need 1 to 2 days off work and are returning to normal, non-strenuous activities in under a week.
But no matter which method you use, there is the dreaded compression garment. I've seen people wearing these tight, restrictive bodysuits for weeks. What is the biological purpose of that?
The compression garment is completely non-negotiable. Remember that physical void we just discussed?
Yeah, the empty space under the skin.
Right. The compression garment acts like a continuous, firm external hug. It physically forces the skin down to adhere to the new, underlying muscle contours.
Oh, so it closes the void.
Exactly. It provides counter pressure that prevents massive pockets of lymphatic fluid from pooling in that empty space, and it supports the retracting tissue so it heals smoothly.
Yeah, that makes total sense.
Patients must wear this consistently for weeks. And the final, true result, the ultimate shape of the new body, does not fully settle and reveal itself for 3 to 6 months as that deep, microscopic swelling finally resolves and skin finishes contracting.
And this brings up a crucial safety limit. Sometimes patients go in and demand a surgeon just take out every single ounce of fat they can find to get as skinny as possible.
Which is a terrible idea.
Right. But responsible surgeons will flat out refuse.
The responsible surgeon will always refuse to oversuction. The human body needs a thin, healthy layer of subcutaneous fat to look natural, to keep the skin healthy, and to heal properly.
What happens if they do take too much?
If a surgeon oversuctions and takes out too much fat in one session, the skin will adhere directly to the underlying muscle in a very harsh, unnatural way.
Yikes.
It causes severe contour irregularities, so lumpiness, strange shadowing, or permanent dents in the skin that look like craters. Those irregularities are incredibly difficult, sometimes impossible to fix later. A good surgeon prioritizes a smooth, natural contour over maximum volume extraction.
It's all about proportion, not just reduction.
Exactly.
Okay, let's unpack everything we've covered today. We are looking at a 50-year-old procedure that has completely reinvented itself through microscopic technology.
It really has.
It has adapted to a post-pandemic world where men and women are hyper-focused on their contours, aided by incredible tools like lasers, ultrasound cavitation, and topographical mapping.
And it highlights a fascinating intersection between systemic medical treatments and surgical aesthetics. We now have pharmacological tools like semaglutide altering the body's overall mass, and surgical tools refining the body's specific shape. They're working in tandem.
Which makes me wonder about where this is all heading for you, the listener, if we connect this to the bigger picture. Well, if weight loss drugs continue to advance and they effectively cure the systemic issue of obesity for the masses, will the entire future of liposuction shift completely away from the concept of fat removal?
That is the million-dollar question.
Right. Will it evolve to become purely an artistic endeavor, entirely about muscle etching, structural definition, and high-definition body sculpting?
That raises a profound question about the future of aesthetic medicine. If the volume problem is solved by a weekly injection at home, the surgeon's role transitions from a remover of mass to a pure sculptor of human form.
It is wild to think that the scalpel of the future might just be an artist's chisel, something to definitely keep an eye on as these technologies collide. Thanks for listening to the Plastic Surgery Playbook.